Hi, I'm Joe Feeks, editor of Pig Health Today, and with me is Dr. Bill Hollis. He is a veterinarian for the Carthage Veterinary Clinic in Carthage, Illinois. Thanks for joining us, Bill.
Sure, Joe. Happy to be here.
You and hundreds of other veterinarians every year go to the American Association of Swine Veterinarians Conference. You go to the Lehman Conference. There are all these wonderful meetings where swine research is presented, and that's great. But when you leave those meetings, what happens after you get back to the clinic, and more importantly, when you get on the farm?
Well, that's a great transition for a lot of our veterinarians, including myself, where you go to the meeting, you get exposed to some exciting information and research specific to infectious disease and some just simply production improvement. Then it's getting back home with all that enthusiasm, sharing the message, and a big part of a veterinarian relationship is explaining and interacting with producers and employees, and furthermore, bringing them the new tools to improve the health of the pig.
Bill, give me an example of a time you went to a scientific conference, you get really excited about a new piece of research, a new idea, and you brought it back to implement. How did you go about moving that forward?
Many of the farms that we manage would have anywhere from 5 to 10 farmer owners. And so those owners have said, I no longer want to have 500 sows at home. I want to be a partner in 5,000 sows, where my 500 sows are part of this bigger group of people. And in that 5,000 sow farm, you now have 20 hired employees, you have 10 owners, you have possibly 20 or 30 different locations where pigs are being fed. So after the vet group goes to a meeting and has a conversation about an infectious disease process or a production challenge, they now have to bring that information both to a group of owners and to a group of employees and staff, and possibly even to another group of folks that are feeding those pigs, and help them all understand, okay, this is the path we want to go down. The biggest challenge we've had in the pig business has been PRRS virus. Over the last several years, so I would say somewhere between 5 and 10 years, we have become more disciplined about our approach on the farm with the management of the virus, both to control and then to eliminate the virus, and then in monitoring the outcome. So what's the outcome in terms of pig quality, pig health, the throughput, the pig performance numbers, and do the decisions that we make on farm make a change, and is it better or worse?
And so when you present all this information, though, I mean, how do you go from point A to point B to point C to actually lay out the program that you're going to use on these farms?
It's in that PRRS example, it's highly dependent on the individual farms and their current situation. So if we're in a gilt multiplication portion, so about 20-25% of our business is managing and overseeing gilt production, breeding stock. Those farms eliminate PRRS. Those farms work incredibly hard at both biosecurity and protection, and if we identify virus, as quickly as possible, eliminate and remove virus from the equation. We want gilts, breeding stock, naive to PRRS. Growing pigs, however, are a very different conversation. If we have a commercial production system in what I'd call a high-risk area where there's PRRS pressure and the risk of PRRS introduction, we may want to manage that virus with the introduction of vaccination and with current practices on farm. So to your question, how do you introduce it? Well, you start with the staff, you understand the farm, you understand and diagnose the situation you're in, and then you take that to the ownership of that farm, which could be one person or it may be 10. And you have a conversation about, here's our current situation, both in terms of the herd itself and then the outcome, the pig quality. Then the discussion goes to, where do we want to go next? Do we want to manage that disease? Do we want to stabilize the herd and monitor that outcome? Or do we want to work to eliminate it entirely? And if we're going to eliminate it, how do we protect the herd?
Now, PRRS rarely acts alone. There are other viral and bacterial diseases that may be at work. That's got to be part of the discussion too.
Oh, sure. Yeah, in fact, we have many conversations at the meetings about secondary bacteria, about other viruses that interact, and about the changes in vaccination programs. So mycoplasma, for example, can be highly influenced by the activity of PRRS virus. And we've had researchers explain that to us in the infectious disease process within the pig. What we then have to do is implement our vaccination and our control strategies. And again, in that gilt situation, we'd like our breeding stock to work to eliminate mycoplasma as well.
Now, we've talked a lot about vaccination. You mentioned mycoplasma. It can be controlled with antibiotics, but the industry has been under a lot of pressure to reduce or eliminate antibiotic use. What are you seeing in the field?
We're seeing the same question being raised, and it is coming from the producers as well. How do we work to judiciously implement an antibiotic program that both minimizes the effect on the pig, because if you start removing antibiotics, we don't want to see an explosion of infectious disease. So what we've worked on are these measured steps of elimination where both practical and where we can be successful. Our gilt multiplication, again, in our Carthage system, is eliminating mycoplasma. In fact, we're almost done with the last farm where all the multiplication will be naive to mycoplasma. The next step that comes with that, however, is introduction of that mycoplasma naive animal into farms that still have the organism. So we already talked about PRRS. Well, we want PRRS to be out of the equation, whether it's stable and the pigs are negative or we've got it under control. Then we can work on this introduction of a mycoplasma naive animal, possibly even a long-term strategy to eliminate mycoplasma from that growing population. But we have to respect that challenge of introducing a mycoplasma naive animal into a herd that has the organism.
And so is prevention a better approach?
It can be, yes. So by prevention, introducing vaccine to all the pigs, yes. And in fact, I would say a very large percentage of the industry do use mycoplasma vaccination. It's a proven, highly effective method to stimulate immune response. So we have an immune response, but it does not prevent the infection from the organism. So we also have to plan for that infection. And again, in the example of introducing a naive gilt, now say that commercial herd has somewhere around 50% of the population that have been introduced naive. What happens if we have reversion back to activity? We have a sow herd that now becomes active. The second question then is, how do we respond aggressively to stop the activity, which does require antibiotic therapy. It may require a booster to that entire sow farm. And it's a message that needs to be understood by all parties. So the growing pig population may be highly affected by this transition in the sow farm. The sow farm may not see it coming, and so we have to be planning for that activity. I guess we need to learn to predict the future and understand that risk, and utilize both a prevention and a treatment course of therapy that minimizes the impact on the growing pig.
When we look at the growing pigs, I mean, you really have two types of antibiotics that are available. You can put them in the feed, or you can use injectables, or I guess you could go through the water as well. What's a decision tree? Can you walk me through, like, when would you want to use a feed medication? When would you want to use an injectable or a water antibiotic?
Let's stick with mycoplasma just as the example and say we know that we have a stable but positive herd of sows that is producing a baby pig that is immunized or vaccinated, but we know there's a small amount of infection in that pig. Because many of our farms are farrowing every week, and we have throughput or production of baby pigs leaving the farm every week, we have many groups that we can monitor over time and introduce a window of treatment. Some of our farmers call it the 16-week wall, that we know at that period, that 16 weeks, there's going to be activity to that organism. So to minimize that, we place a targeted antibiotic therapy in the feed. Now, the other two options you mentioned are quite possibly in the toolbox. The oral medication through the water or the injectable therapy to individual pigs are both highly effective when we know where to target. So the injectable, for example, is those individual pigs that for stress or whatever reason has a higher incidence of infection. They're showing you clinical signs of disease, and we're teaching the staff and we're walking those barns, and we know there's a percentage we have to look for every day, and we mark them or we separate them to a pen and we inject those pigs with an antibiotic that we know will be highly effective against mycoplasma. Sometimes, in the example of a virus, we have an infection that comes in and we weren't planning on it. And that explosion can lead to a very rapid presence of respiratory disease. In those situations, we already have the bins full of feed. There's more pigs than we can inject today. We need to get ahead of it with an oral therapy, and those would go in the water and use a pump, and we'd medicate the entire population in, say, a 5-day period.
So it's really an integrated approach. I mean, you have to kind of, there's some planning you can do on that, but you kind of have to just go with the flow of the pigs, I guess.
Well, and it has to be in the best interest of the pig.
Yeah.
We need to be able to communicate with the folks that are receiving the pigs next week and next month, and we need to be able to learn from the pigs that were placed last month, and we need to have the conversation about what do we anticipate, what disease pressures do we know are present, and then how do we minimize the impact of those with targeted therapies, whether that be a feed pulse or a change, and now we have to place in a water medication, or in an everyday action, it's walking the barns, understanding the pressures of disease, and sorting those pigs that need an individual injection.
How important is duration of treatment? Because I know, like with feed medications, you know, you might be able to keep it in the feed there for 14 days. It sounds like a pretty good insurance policy. If you're using an injectable, it's a shorter duration, isn't it?
Well, and that's judicious use of specific targeted therapies. And so there are elimination curves of the antibiotic through the body of the pig. And we know through our communication with pathologists and our understanding of the organism, we know that the targeted level of a therapy has to be at a certain point. And so we do the math and we calculate the weight and the timing and the placement of the antibiotic, and we know that peak antibiotic therapy has to get at a certain level. If we're injecting, we can get there much faster, and so that's why the injectable therapy is so critical for that sick pig. Sort them out so they're not beat up by their pen mates, inject that pig and reach that high level of antibiotic therapy very quickly. If we're using an oral method, so that's through the water or through the feed, we have this slower increase to that therapeutic level, and we may need to feed or go through the water for a longer period of time for the individual, and because we're treating this large population that have various stages of infection. So it has to do with both the science from the researchers that tell us how those antibiotics are leaving the body, and then the person that's looking at the pigs that says, well, these pigs are beginning to recover, or no, we're not seeing recovery. We need to have this conversation. The veterinarian gives some more direction. How do we continue therapy?